Hello and welcome to Decentralized Health Administration at the Ubrica Project. My name is Dr. Macharia Waruingi. I bring you critical technical knowledge about creating perfect conditions for much needed revolution in the health industry. Under these new conditions, universal health access will be possible. Everyone in the world, including you and your loved ones, will have access to the best health services available. Health for everyone will be of the highest quality there is in the world, and it will be affordable by everyone. I come to you each and every day from Ubrica Project, located at 1.4 degrees south of equator and 37 degrees east of the East Central Meridian in the southwest suburbs of Nairobi. Today, I have great things to discuss with you. Number one, we discuss about President Uhuru Kenyatta's highlights on the blockchain as a key component for collaboration during the Afro-Asian FinTech Festival today in Nairobi. And number two, we will discuss the topic of public health itself as discussed in Decentralized Health Administration textbook under development under Susan Nyambura Njuguna in Ubrica Research and Development Team. First, the basics. Many people ask, what is Ubrica Project? Ubrica Project strives to solve three fundamental problems of health production in the world. And let's say in Africa in general, let's say in Kenya specifically. Number one, lack of access to health services. Number two, poor quality of health services. And number three, high cost of medical services in most of the world. And of course, mainly in Africa and in Kenya. Lack of access to health services occur when people do not have money to go to the hospital. People don't have money to go to the hospital. And lack of access can also occur when there are no hospitals to go to. So there you see two problems. Poor quality of medical services, on the other hand, occur when good knowledge to deal with medical problems is scarce, and high cost of medical services in most of the world occurs when manufacturing of products that can be used health is stifled. So we are not making products that we can use in hospitals. Then we solve the problem of lack of access due to lack of money by creating SOKOJANJA.com, an online retail store where anyone then Ubrica clinics and hospitals project will ensure physical access to health services. What about Ubrica Science and Technology Parks? They will create places for translation and commercialization of new and relevant knowledge, ensuring best quality of medical services for themselves and in the world in general. Let's talk about the Ubrica Biomedical Industrial City, promoting local manufacturing of biomedical products, reducing the cost of medicines and medical devices, and even health services in general, and making health affordable to all. Ubrica, the UBN, UBN is the cryptocurrency for universal health access, underwrites health production in Ubrica ecosystem. Now, you can support universal health access by getting and adding Ubricoin to your portfolio of cryptos or by getting equity in the Ubrica project. Get involved. Do not sit on the sidelines of health. You can get even more involved by joining the World Ubricoin Ambassador Program, where you gain deeper knowledge about Ubrica project and continually share the knowledge with people in your circle of influence. As an ambassador, you will be the bridge between Ubricoin, Ubrica, Sokojanja, and the people in the world. So as you listen to this, do not forget to hit the like button to cement your support. Hit the bell button so that you can receive notifications and participate in the chat. Share your views on how we can decentralize health. We can decentralize knowledge in health and medicine. Yeah. Let's look at today's news. Today, President of Kenya highlights blockchain as key component of collaboration during the Afro-Asia FinTech Festival. Now, is the president highlighted the sign the signing of memorandum of understanding between the government of Kenya and the government of Singapore set the foundation for joint innovation projects on the application of key emerging technologies in digital mobile payments like Ubricoin. Blockchain technology is what Ubricoin is built on, and big data, and of course, artificial intelligence. We're talking about this in public health and, of course, in health administration. And let us dive deep in the topic of public health because this helps us to understand where we are going, particularly how the discipline of public health emerged and where it may have gone wrong is during its emergence. Now, this, as we said before, it's coming from the textbook Under Development by Susan Nyambura Njuguna and Ubrica Research and Development team here in Nairobi. As people became aware of causes of diseases, the concept of public health began to crystallize. People started realizing the importance of disease control as both a possibility and a public responsibility. Public organizations and agencies were formed to employ newly discovered interventions against health threats. Now, in the 19th century, we saw great advances in public health. Sanitary reforms, as we talked about yesterday, for preventive sanitations were introduced. Now, this was the first public health development in the 1930s. Squalor was identified as both the cause and vehicle for transmission of diseases. Squalor is a synonym of absence of money, or poverty, or economic deprivation. Now, that was, yeah, highlighting lack of money, but we didn't say wealth creation is um, an, a cause of diseases to disappear, but we talked about squalor, and I think that's where we started going wrong. The problem was that the theory underpinning public health failed to recognize the relationship between squalor and absence of money or socioeconomic deprivation. Squalor and absence of money. So we talk about squalor, but we didn't say there was no money. That, public health school of thought suggested that people could achieve cleanliness without money. Ensuring cleanliness is a primary component of social reforms. Clean water, garbage collection and management, environmental services cost money, without which people cannot become clean. So they slide back into poverty or squalor. Epidemiology was being used in investigation of diseases occurrence. Hippocrates, John Grout, William Farr, John Snow, and others contributed to the emergence of epidemiology and statistics in the field of health. All along history, the importance of money was overlooked in public health discourse. Even Hippocrates himself, Hippocrates in about 400 BC, attempted to explain disease occurrence from rational rather than supernatural vintage. And Hippocrates suggested that the environment and, of course, the host factors, we're talking about human factors, could influence development of disease. And then later on, John Grout published A Leading Light of Mortality Data in 1962. His work was built on William Farr, who is considered today the father of modern statistics and surveillance, because he collected and analyzed Britain mortality statistics. And in 1800s, John Snow, an anesthesiologist, conducted a series of investigations on cholera outbreak to discover the causes and to prevent the occurrence of cholera itself. So John Snow is considered the father of epidemiology. There's a dog barking in the background, but don't mind it. It's just been fed. It's a very happy dog. Well, in 1960, public health activities were still in confinement of local cities. States formed their own health boards in 1870s and 1880s. The boards were formed to control disease, especially epidemic seasons, to prevent them from gaining to prevent diseases from gaining niche in the cities or in the towns. Health boards, in our view, are backward looking. The orientation towards control of disease that had already happened robbed the boards the opportunity or of the frame of mind to formulate ways to stop disease before they happened. Forward-looking orientation would stop disease before it occurs, before it becomes a public health concern, and artificial intelligence built on blockchain technology will do a very good job at that. Yeah, so what do we do now? We see that today, epidemiology is used in public health to characterize health of communities. Epidemiology is also used to collect data from surveillance, monitoring, evaluation, and developing intervention to solve health issues. Traditionally, epidemiologic methods have focused on measurements of exposures, outcomes, and program impact through reductionist method, yes, complex statistical modeling. Even as epidemiology continues to develop in the path of discovery of the relationship and causes of health outcomes, there has been no consideration on the effect of how money is created and how it is issued to health outcomes. With advancement of technology, the field of epidemiology can now move to the blockchain. It is critical that this time around, epidemiology considers the effect of creation and issuance of money on health outcomes. Blockchain technology simplifies the thought model about creation and issuance of money in relation to health outcome. And of course, we are saying that we are at a point when we have the technologies to do this. The distributed ledger technology, blockchain, and cryptocurrencies can help us to reimagine and redefine how money is created and how it is issued. Unlike the traditional fiat money, which is only created for the rich and issued only to the rich, blockchain money is created for everyone and issued to everyone. And due to blockchain's accessible, distributed, uncensored, and uncontrolled nature, it is most fitted to ensure that we have universal health access. Again, ladies and gentlemen, Ubrica project strives to solve three fundamental problems of health production: lack of access to health services, poor quality of medical services, and high cost of medical services. So Kojanja itself is an online retail store where anyone in the world can sell what he or she produces to increase earning power. And we see it again that money in the pocket is realized access. Ubrica clinics and hospitals projects ensures physical access to health services, and Ubrica science and technology parks create places for translation and commercialization of new relevant knowledge and to ensure best quality of medical services in the world. Ubrica Biomedical Industrial Society promotes local manufacturing of biomedical products, reducing cost of medicine and medical devices and health services in general, making healthy affordable to everyone. So let's say that now things are easier because we have cryptocurrency, which is UBN, Ubricoin, our cryptocurrency for universal health access that underwrites health production in Ubrica ecosystem. You can see now with epidemiologic knowledge, we can have big data, we can have artificial intelligence, and we can detect diseases before they occur. And that's why it is very, very, very important that we hunker together and get this done. You can now support universal health access by getting and adding Ubricoin to your portfolio of cryptos or by getting equity in the Ubrica project. Get involved. Do not sit by the sidelines of health. You can even get more involved by joining the Ubricoin World Ambassador Program, where you can gain deeper knowledge about Ubrica project and continually share that knowledge with the people in your circle of influence. As an ambassador, you'll be the bridge between Ubricoin, Ubrica, and Sokojanja, and the people in the world. As you heard, epidemiology has done its job. Right now, it's up to us to add money to epidemiology. Epidemiology is a discipline that has evolved without money, and it does consider how creation and issuance of money could influence diseases. Thank you so much for listening tonight. Send me comments about epidemiology and how, if we combine epidemiology with creation and issuance of money, how that will affect the health outcomes. I'm quite sure that we could improve access to health services, we could improve the quality of services, and of course, lower the cost of health. Thank you.